So as we start to wrap up today, I just want to remind you of some of the things we've discussed today. So we shared some high value insights on how inclusive elements can be applied to all the steps of the development process, from the initial boardroom conversations to each step in the digital health measurement development process. The market opportunity calculator and library of evidence will help you make the business case for inclusivity. You can then take specific actions by following the digital health measurement product development process. And then the framework for inclusive development will let you identify and apply specific inclusive considerations to each step of the product development lifecycle. But we know it's not enough to be inclusive in developing the product. The product is only valuable if it's being used. So we also shared with you some insights on operationalizing inclusivity, and you heard really nicely from our panel of how to be brave and start asking these questions. We provide specific instructions and recommendations that you can apply to your work right now. The toolkit for inclusive deployment will help you support your patients, your participants, and your teams. These resources will help empower patients and participants to be more informed with clinical care and research. And the implementation tools can be applied to existing processes. And Carrie and Jamila told you some nice examples of that. And then finally, the library of resources, which Amy mentioned, it gives you quick access to curated public resources that can guide you to being more inclusive in your work. The vision for DATAcc is to achieve the promise of digital health measurement to improve lives for everyone. For our first cycle, we tackled inclusivity. And today we showed you the results of this massive collaborative effort. We want to tap into the expertise and collaborative environment of DATAcc to continue to tackle some of the most pressing challenges facing digital medicine. We're looking to all of you to guide the evolution of care and research for digital health measurement. So there is a lot more work to be done. The new cycle of DATAcc will begin in June. We welcome you to join us. These are some of the topics that can result in project work streams, and you've heard the word data many times throughout this webinar. And as you can see, there are lots of different potential work streams tackling different areas of data. These topics or challenges that digital health medicine is facing, we know these cannot be solved by one group in isolation. I mentioned earlier that DIME sits at the intersection of healthcare and technology. And the reason for this is that digital medicine is facing challenges that healthcare or technology alone cannot solve. But this is where DATAcc is most powerful. We invite you to join us. If your organization is interested in participating, please attend one of the open call information sessions. We will put this link in the chat, and you will also receive it in the post-event email. We do have a few minutes, so I would love to open it up for questions. And I would invite my colleagues, Jean and Jen, to join me. So do we have, please put your questions either in the Q&A box or in the chat.
Fantastic. There was one that popped up earlier, Yashoda and Jean, that I think is really important. And in fact, Yashoda, I know you're working on a piece to document and define inclusion. In this context, can we have a rallying cry as we move to wrap up on how this community has decided to define inclusion vis-a-vis digital health and digital health measurement?
So yes, so one of the starting piece for the work that the steering committee did back, I believe in July, was to try and define inclusivity. And so we know the standards of demographics, but we also know we're talking about digital devices, digital technologies. So demographics is not important, not enough. Socioeconomic status plays a big factor. And then we have to whittle that down to being very deliberate and intentional with digital health access versus digital literacy. And we need to really focus on social determinants of health. And so that's what the DATAcc steering committee has done, is called attention to the demographics. We know race and ethnicity has been a challenge for health equity, but there's also age, and age is a big factor as we look to digital health technologies, but socioeconomic, social determinants of health, religion, language, all of these factors play a part in, as well as physical and mental abilities, all play a factor when we talk about equity and inclusion. And so the DATAcc steering committee has put together a list that we will be sharing more broadly to help define that for people, so that we are all starting the conversation and continuing the conversation with the same language, so that we don't leave anyone behind.
Fantastic. I am so incredibly proud, Yashoda, of what you and Jean have championed with this community. It's been a delight to be watching the chat today and see people responding to, engaging with these resources right out of the gate. I think that is a reflection on what you, the 46 leading organizations that we've had the privilege to host, and all of those individuals who have been tireless and determined over the course of the last year in order to create this one-stop shop. Again, that's a technical term for, why should we be doing this work? How do we do it? Who do we need to take with us? We've learned today about the importance of being brave, of being fearless. We've learned about meeting our partners in our field where they are and thinking about value for everyone. We've learned about the fact that these tools are powerful new tools in the toolbox, but they aren't going to solve problems by themselves. That opportunity, that imperative sits with each of us.